My name is Catherine Kaplan, and I'm the Chief Learning Officer at Maimonedes.
And my name is David Feldman. I'm the Vice President for Perioperative Services and Vice Chair of the Department of Surgery here at Maimonides.
Maimonides Medical Center is among the largest independent teaching hospitals in the United States. We are a 705-bed hospital located in Brooklyn, New York.
Our employee pains were typical of most hospitals. Our operating rooms often experienced times of tension, frustration, and staff bad behavior. For example, our surgeons often lost their tempers when they received the wrong equipment or had to wait for patients to be transported to the recovery room. Nurses felt physicians cared only about completing their cases, while surgeons thought nurses only showed up to work a shift.
Consequently, professionals in the OR frequently did not feel safe to share opinions or speak up when patients were at risk.
So I had attempted to pioneer something called a code of mutual respect, but I was frustrated because it existed more on paper than in the reality of my team's behavior. Well, in my efforts to bring the code of mutual respect to life, I turned to Dr. Kaplan for help.
I began scouring the respect literature, and I found VitalSmart's study called Silence Kills, which revealed the impact poor communication has on patient safety. And it really spoke to what I've experienced in healthcare, previously as a practicing therapist and an organizational development specialist. Shortly after, we became certified to teach the training course to those in our hospital.
We began training in January of 2006 and started with 250 doctors, nurses, and staff from the surgical teams. I'll never forget how employees reacted after our CEO took the stage at the first training session. She told them the code of mutual respect was coming to life, the operating room was first, and that no one was immune. Immediately, the nurses started clapping. It was very powerful.
The results have been substantial. Judging from both formal measurement and observation, we're confident that we're on our way towards creating the tipping point for transforming the culture of the hospital. What's really exciting is that we've seen a 54% improvement in the perception that leaders handle disrespectful behavior effectively, and a 39% improvement in the willingness of people to speak up when they see someone violate the code of mutual respect. And these changes have an impact on team communication and, most importantly, patient safety.
And the results also really echo the behavior we see. There's no question that people are more willing to speak up when mutual respect has been violated and when patient safety is at risk. In fact, just 2 weeks ago, I witnessed a nurse stop a surgery because she was concerned the patient had not been correctly identified. And I recall a doctor announcing to everyone during a training course that he realized he had been part of the problem. That confession just really blew people away. And that's exactly why we are doing this training. So moments like that happen every day in our hospital.